This video will demonstrate the use of electronic fetal monitors, or EFM, as it pertains to the implementation in the new Women's Hospital Level 3 inpatient unit. This video will include an introduction to EFM and an explanation of its benefits, an overview of the EFM devices, monitors, cables, and connections, and a review of a generic workflow for your unit. The Women's Hospital Redevelopment Project is implementing an electronic fetal monitoring application in areas of the Women's Hospital, including Level 5 Inpatient Antepartum, Level 3 Inpatient Labor and Delivery and Obstetrical Triage, and the Fetal Assessment Unit. The fetal monitoring application is a comprehensive computerized system for central, bedside, and remote electronic fetal monitoring. It will be used to display and record fetal and maternal physiological data obtained from the fetal monitors. Benefits of the fetal monitoring application include that it displays the monitored data from one or more patients in the patient rooms, and that in some units, the use of a central patient surveillance will display an overview of all EFM unit-wide activity. Additional benefits of the fetal monitoring application include that it provides tools to assist clinicians in evaluation of fetal heart rate patterns, that it provides remote access monitoring outside of the patient room, and that it captures the EFM tracing data and stores it electronically. Now, let's take a look at how the mobile fetal monitors may be set up. Areas that will utilize mobile fetal monitors would include the obstetrical PACU and the obstetrical triage unit. These mobile fetal monitors will be placed on a cart that also has an integrated workstation and monitor installed. In the obstetrical triage area, these carts will be stationary and already attached to the network, but can also be moved if required. The monitors in the obstetrical PACU will not be connected to the network, and therefore they will need to be connected to the network. To do so, you must connect the end of the green Ethernet cable to the green wall jack outlet located at the patient's bedside. If there are any issues with the device or connections, please call the Shared Health Service Desk at 204-940-8500. In the triage unit and stretcher bays, an integrated fetal monitor and workstation cart will be used. Besides the mobile fetal monitor, each cart will also have a workstation and monitor that will be used for clinical EPR, on which the user can also access the patient manager screen from the fetal monitoring tab, a bedside display, which will display the tracings for the current patient on the top of the screen. Tracings for additional patients that are being monitored will be on the bottom of the screen. This display can be configured to the unit's workflow requirements. Now, let's take a look at how the equipment will be installed in the labor and delivery area. Fixed fetal monitors will be used for the L&D area. These monitors are already connected to the network, and you will not have to make any connections. This diagram illustrates how the fixed fetal monitors are connected. If there are any issues with the device or connections, call the Shared Health Service Desk at 204-940-8500. Installed on each bedside desk in the labor and delivery area will be one fixed workstation monitor that will be used for clinical EPR, on which the user can also access the patient manager screen from the fetal monitoring tab, and a fixed bedside display. On this display, you will see the tracings for the current patient at the top, and tracings for additional patients that are being monitored will be on the bottom of the screen. This display can also be configured to the unit's workflow requirements. In the labor and delivery unit, the central patient surveillance will be located in the L&D report room. This display can be configured to the L&D's workflow requirements. Now, let's see how to use the fetal monitoring tab in clinical EPR. For the purpose of this demo, the following activities have already taken place. Our patient has been registered in EPR. The devices in the triage and L&D areas have been connected and do not need to be connected by the user, and the patient is connected to the device. We will now review the generic workflow for using fetal monitoring tab in clinical EPR. As a reminder, you can use the following three methods to put a patient in context: by going to the status board, going to the patient list, or clicking on the Find Patient icon. Confirm your patient is in context in the patient header and the visit is in ADM status, and then click on the Fetal Monitoring tab. The Fetal Monitoring application opens to the Patient Manager window. Confirm your patient's name and the bed number by reviewing the patient header information in the Patient Manager window. Please note that the trace will be displayed in the Patient Manager window on the clinical EPR workstation and monitor and on the bedside display. Also note, for patients in the labor and delivery area, the trace will also display on the central patient surveillance monitor in the reporting room. You will notice at the start of the trace that the date, time, and the bed number for the patient will appear at the top left-hand side. The next step will be completed on the fetal monitor itself. You must enter the patient's demographics in the Enter Patient Demographics screen on the fetal monitor. Enter the following: first name, last name, and MRN. At this time, you are going to retrieve patient measurements into a flowsheet in EPR. To retrieve the measurements into the flowsheet, do the following. Click on the Flowsheets tab. Please note that the retrieval of information from the electronic fetal monitor is available in the Vital Signs flowsheet and the Obstetrical and Labor Record flowsheet. For this video, we are going to use the Obstetrical and Labor Record flowsheet. Click on the Obstetrical and Labor Record flowsheet, click on the Vital Signs header, and add a new time column by clicking on the Add Single Time column icon and changing the date and time of the column if required. If this was a late entry, you can change the time of the new column and add a late entry comment into the header. Note that measurements done on the fetal monitor will also flow to the fetal tracing, including into Patient Manager. Maternal vital signs, including BP, P, and SpO2, may be pulled into the EPR. Measurements can be retrieved into a flowsheet using the following methods. Which one you use will be determined by your requirements and workflow. A single data field, for example, the blood pressure. B, all data fields in a data cell, for example, the pulse oximetry. Or C, all data cells under the header, for example, all cells available under the vital signs header. To retrieve the measurement for a single data field, do the following. Place the mouse cursor into the data field, in this case in the beats per minute field, in the heart rate cell, and double-click. Note that a single fetal monitor data measurement appears in the heart rate data cell. To retrieve all measurements for all data fields in a data cell, do the following. Place the mouse cursor anywhere in the data cell. In this case, we are using pulse oximetry. Right-click and select Auto Enter Cell Selection Device Interface. Note all data measurements appear in the data cells. Finally, to retrieve measurements for all data cells under a flowsheet section header, do the following. Place the mouse cursor in any data cell under the Vital Signs section header. Right-click and select Auto Enter Header Selection Device Interface. Note that this will bring in all data measurements under that header. Please note that there may be a delay of a few seconds before observations from the device appear in the time column. Note that no matter what method you use, the next step is to validate the data in the flowsheet against the data values on the fetal monitor and/or the tracing in Patient Manager. Continue to chart assessments in the Obstetrical and Labor Record flowsheet as applicable. Note that some data that you have charted on the Obstetrical and Labor Record flowsheet will flow onto the tracing. For a complete list of annotations, please see the Annotations reference listing. Click Save to save the time column. During the trace, you may want to use eTools to help with your evaluation. eTools can be used within the Patient Manager window on an active tracing or a completed tracing on an admitted patient. eTools consist of the fetal heart rate or FHR tools, which assist in the assessment of baseline, variability, acceleration, and deceleration of a fetal heart rate, and the uterine activity or UA tools, which assist with the assessment of uterine activity in intrapartum labor such as contraction, frequency, duration, and relaxation time. For the purpose of this video, we will demonstrate how to set up a fetal heart rate baseline. To do this, right-click on the trace screen, and then select eTools from the menu, and the listing of available eTools appears in the quick menu to the right. Select the FHR Tools baseline from the drop-down menu. A red line will appear on the screen. Move the mouse to scroll up and down on the screen to move the baseline to the desired location. Position the red line over the top of the desired fetal heart rate baseline for this patient. The selected FHR baseline will appear in the upper left corner of the tracing display. It is displayed in increments of 5 beats per minute. Once the trace is complete, do the following. Disconnect your patient from the fetal monitor. The fetal monitor stops taking and sending measurements, and an information box will appear at the end of the trace noting the date and time of the end of the trace. The trace will also stop displaying on the bedside display and on the central patient surveillance monitor. The next step will be completed on the fetal monitor itself. Click the Discharge button on the patient demographics screen of the fetal monitor, and this will discharge the patient from the fetal monitor. If the fetal monitor is being removed from the room, disconnect the mobile fetal monitor from the network by unplugging the green Ethernet cable from the wall jack, and then continue with unit workflow. A clinician may use the e-tools to help evaluate the patient traces. The two types of e-tools available are the fetal heart rate or FHR tools and the uterine activity or UA tools. E-tools can be used within the patient manager for an admitted patient's active tracing or past tracing. Both the bedside display and central patient surveillance have alert and monitor indicators. Default setting for alerts will be determined by unit-specific workflow. Numbers 1 through 4 show the location of the alerts on a bedside display. This slide shows a partial listing of the most common indicators that may appear on the bedside display and the central patient surveillance. A complete listing of all alert indicators is available in the Alert Indicator Quick Reference Guide for all clinical users. If your patient is admitted and you want to view a current trace, you can do so by accessing the Fetal Monitoring tab in Clinical EPR. Ensure your patient is in context in the EPR and click on the Fetal Monitoring tab. The Patient Manager will open to the live trace. Check the patient's name and location in the header bar to make sure you have the correct patient's tracing. If your patient is admitted and there is an existing trace, you can access it from the Fetal Monitoring tab in Clinical EPR. Ensure your patient is in context in the EPR and click on the Fetal Monitoring tab, and the Patient Manager window opens. Check the patient name and location in the header bar to make sure you have the correct patient in context, and then click on Tracings from the menu bar, then Display. Your patient's tracing will open. If your patient is admitted and you want to view existing traces, put your patient in context in Clinical EPR and access the Fetal Monitoring tab. The Patient Manager window opens with your patient in context. Check the patient name and location in the header bar to make sure you have the correct patient's tracings. Each trace is timestamped at the beginning and the end. See the red boxes at the beginning and end of trace number 2. You may also search for a specific date and time by right-clicking on the tracing, choosing Select Time from the menu, and then the Select Date and Time box will open. Enter the date and time you wish to view and click Go To. To display existing traces on a patient that has already been discharged, do the following. With the patient in context in Clinical EPR, click on the Fetal Monitoring tab. Ensure your patient in the patient bar is the correct patient, and then click on Tracings in the menu bar. Then click on Display. The OBIX Select an Encounter window opens. Select the appropriate encounter or visit. Note, in this case, you will see one encounter, but you may see many depending on the number of patient visits. Click on Trace Display. The trace opens in the Patient Manager. This concludes our training video on the use of electronic fetal monitoring. Please contact your clinical educator for more information.